A rare operation at UW Medical Center saved a baby boy's life. It took a team of doctors days to prepare for this procedure, which is only done about twice a year at UW. I spoke with the Tacoma couple who described what it was like to have their baby operated on in the middle of his birth.
Wow, he's doing great. He's been surprising everyone.
Every breath that baby Oliver takes is a gift, especially when you learn that when mom Lauren was 18 weeks pregnant, she got some frightening news.
It was scary. You know, I was at work and she called me bawling.
They told me that that Oliver had a underdeveloped jaw and a cleft palate. And they said, we suspect that he has Pierre Robine sequence.
Because of his tiny jaw, Oliver's tongue blocked his airway, making it nearly impossible for him to breathe after he was born. So doctors at UW Medical Center recommended ex utero intrapartum treatment, or EXIT, a risky and rare procedure that would give Oliver a chance to live.
And I think the day that we found out we were having the exit procedure, they probably described the actual surgery to me like 10 times, because I was just like, what?
You know, there's always a little bit of anxiety anytime you're doing one of these complex airway procedures.
Go forward.
Dr. Jake Dahl was part of the team of 30 surgeons, anesthesiologists, and nurses from Seattle Children's and UW who intubated baby Oliver while he was partially delivered via C-section and still getting blood and oxygen from mom.
We tested to see if we could intubate baby Oliver through the mouth, which we didn't think was going to be possible. So then our plan was to pivot towards using a fiber optic camera with a breathing tube over that, placing it through his nose and into the airway.
7 minutes later, doctors were successful.
Once they transferred him from her to the table, I was allowed to kind of stand up and go look at him on the table. And that's when we knew that things had worked out.
Oh, buddy.
Now nearly 2 months old, Oliver is out of the ICU, breathing with the help of a tracheostomy tube.
Hi, Bubba. His lungs are strong. His heart is strong.
Ollie, as his parents call him, will need jaw surgery in the future, but is expected to lead a normal, healthy life, thanks to the miracle of medicine.
I am so grateful for the care we've received. They really walked me through everything so that I was ready, and I didn't feel scared, even though it was a pretty scary procedure. Because of Ollie's tracheostomy, he has to have round-the-clock care, so they can't leave the hospital until they can find home nursing care. And with a huge shortage in home nursing right now, it may be months before they can find a caregiver. So it might be a while before they can actually leave the hospital and go home. It's already been 2 months.
Oh, how stressful in that delivery room, you know, when you have to add that on top of all that's already going on and everything. Incredible, really.
Can't even imagine. I mean, the baby his head and shoulders were out, and they're operating on him while he was still attached to the umbilical cord to the placenta.
Yeah.
It's just, if you think about it, it's mind-boggling.
It is. I didn't even know that was a thing.
Yeah.
So interesting.
Yeah.
Thanks for that
Pretty
story.
cool. And those doctors are incredible.
Incredible heroes. Yeah, no doubt.